Hi, everybody. I'm Dr. David Granite, and welcome to Health Matters. There's an important topic that we need to talk about today. It's a topic of depression, and it's one that's pretty serious, one that's very important, and one that touches millions of people every day right here in the United States. We brought on today an expert who we've had on many years ago, and we were joking before the show that we've both gotten a little more gray and older. And
you have.
Oh, no,
I didn't say I did.
This is Dr. David Feifel. Welcome, David.
Thank you.
Dr. Feifel is a professor of psychiatry here at the University of California, San Diego, where he was also founder and director of the Center for Advanced Treatments for Mood and Anxiety Disorders, which is why you're here, because you are really just one of the top experts on this. And non-drug therapy, psychotherapy, drug therapy, there's new drug therapy. But there's something cool in science fiction-y that we have to talk about. It's just, I mean, I frankly, again, it's something I knew nothing about before we started talking about the show. And I have to make sure I say it right. Transcranial magnetic stimulation.
Right.
TMS.
TMS.
I wrote science fiction in my own notes here. So you got to walk. I mean, is this something that's starting? You know what it is?
Well, right now it's ready for prime time because it's FDA approved, and we are treating people every day with it with a lot of great successes. But at the same time, it's a rapidly progressing field. So we can sense that we're at the beginning of this era of a new approach to treatment. It really is a new approach, David. The idea behind it as well. We have learned, over the the last few decades with advances in imaging that every brain abnormality is associated with an abnormal firing in certain areas of the brain. Some diseases have increased firing in certain areas and decrease in others, and it's a different pattern for each one. And the idea is, well, rather than trying to, indirectly, correct that through, dropping a chemical in your stomach that goes to everyone in your blood, affects all your organs, affects all of your brain, just to target one area and hopefully make that change, why not directly normalize the firing in that area based on how we know it's perturbed? And there is this physical principle called Faraday's law, discovered by Michael Faraday in the 19th century, that you can induce electrical activity in anything that conducts electricity using a pulsed magnet. And some smart people said, well, maybe we can do this to the benefit of patients with brain diseases. And after a little bit of development, it became very clear that this was a viable thing. And by 2008, it advanced to the point where a manufacturer was able to develop a system that demonstrated to the FDA safety and efficacy for depression. They chose depression because in depression there is a lot of very compelling evidence that there's one area in particular on the left side of the brain, towards the frontal area, that tends to be underactive in depression and seems to be causally related to those symptoms.
And you could selectively stimulate that.
Exactly. So the idea was to place a coil targeted at that area and to activate it with high frequency pulses. And the idea, we know when we do that over time, and unfortunately this, like the antidepressants, not like ketamine, does take time, but we're getting at the underlying circuits, and over time those circuits actually start to fire on their own with greater activity.
So you're reinforcing the connections.
Right. And exactly. There are cellular changes, and
so unlike ketamine, not only does it take a long time, it's durable.
Right, so it's almost a mirror profile of it. The irony of it is ketamine tends to work very quickly, but not last very long.
Giving somebody ketamine for a few weeks or months while you're doing the transcranial stimulation.
That's one of the things that we are doing now, using that as the initial ketamine as the initial, boost to get them out, but the TMS as the definitive treatment to get them well.
It makes sense.
It makes sense.
Doesn't mean it'll work, but
well, it is working, and we're seeing people who have not. Even people who've gone to ECT, which was considered, the most effective treatment, even though it's fraught with a lot of, side effects, so people really wanted to avoid it. See, David, until TMS came out, we had a big gap. People would do the conventional things, and when they didn't work, the next big step was ECT, which was really a big jump. People have It means going under the anesthetic. 6 to 15 times. We basically induce a seizure to patients, and there's a lot of recovery in terms of short-term memory loss until the brain kind of backs together.
They don't like it. You don't like it, but it was needed.
It was needed, and it is life-saving to people and psychiatry because it works and it saves people's lives. But we're developing treatments, and TMS is really the most advanced example of a larger field called neuromodulation or neurostimulation, stimulating the brain directly. But the interesting thing is that we can actually increase activity in the brain or decrease it by depending on the frequency we use. So if some diseases are associated with too much activity in areas. So if we make the cells fire at a low frequency, over time they will calm down on their own.
I know that you've been studying this and you do research into it, and for you it's been an evolution and a lot of hard work that you see.
One of the things both of us have learned over time, things take longer than we think.
Yes.
And so you have to go for the long game. And I've watched the field and try to help push it along, and finally it's here. And it's wonderful because we have patients coming in every day, and we have people, changing people's lives. Look, does it work all the time? No. But here's the amazing thing about this. This is technology. And so I mentioned that in 2008 there was, the first FDA-approved TMS device, which is very historical, and it was good. It had its limitations. About 2 years ago, a second-generation device was developed.
Our phones have gotten better, right?
Exactly. And this one goes deeper, and we're getting better effects, less side effects. And I know, because I work with a lot of the researchers and companies, there's more in the pipeline. So we're going to get devices that are more targeted, can go deeper, less invasive, and we'll be at Star Trek at some point. We'll converge to that fantasy at some point, hopefully not in the too distant future.
To see an expert like you, to see this now is just exciting, and I'm glad that you are out there continuing the battle, continuing to make it better. But I think the message to people out there right now is one of hope.
Absolutely.
We're going to have you back again.
Hey, yeah, hopefully not in 20 years.
No, we're not going to wait as long this time because
might be too late.
the outcome is so important to people out there suffering, truly suffering, to think that there are options now out there. So thank you so much for spending some time with us talking about it.
Appreciate it.